One of the focuses of the pre-health program here at Shenandoah is to get students to the graduate program they need to transition to the healthcare profession they want.
I decided to become involved in the pre-health program because I knew I wanted to be a PT, and going to school for 6 years instead of 7 years just seemed like the way to do it.
I think that it'll allow me to get there quicker, which is something that I really want to do. I want to be able to get out into the field right away so that I can start helping people like I've been helped through physical therapy.
I decided to become involved in the pre-health program because it offered a lot of ways for me to make connections before even getting to graduate school.
As Director of Pre-Health Programming here at Shenandoah, my job is to oversee the pre-health program. I am a healthcare practitioner myself. I was a pre-health student. I have trained in the medical profession and I've practiced in the medical profession. And so my job is to guide students and guide our program to help prepare them for their future studies. Students right out of high school can consider our early assurance programs. Those programs are challenging academically, but they also condense a student's undergraduate coursework into 3 years, and their 4th year they actually overlap with the graduate program. So they have an entry into their graduate program 1 year sooner than a traditional applicant. These programs are developed for high school students to expedite their pathway into a graduate health profession program.
I have not heard of many other programs like this. It's really nice having that guaranteed spot that through even like high school, you know that you can get to this program and you can start your career path a lot earlier.
Once you're in the program, you're only doing 3 years of undergrad instead of 4, and then you go right into grad school for another 3 years.
I think it's really unique because the school's so small. You get like one-on-one individual attention, which I really like. It allows for like professors to know students, students to know professors, rather than being in a lecture hall with like 400 people. It allows like for us to be able to go to our professor and say, hey, I really don't understand what you went over in lecture today, and they can sit down with you one-on-one and go over it, rather than you trying to like learn from the internet or from your textbook, which is harder.
I chose Shenandoah because it's close to home and because I had this pre-health opportunity where I could graduate with my doctorate in physical therapy within 6 years instead of 7. And I wouldn't have to worry about applying to a bunch of different schools.
I chose Shenandoah obviously because of the program. You can't pass up this kind of grad school experience. I also love the area. Winchester has a lot to do.
I chose Shenandoah because it was really small and kind of far away enough from my family, but close enough that they could come visit me if they wanted to. And I fell in love with Winchester the first time I came here, and I fell in love with undergrad SU. If I feel super stressed out about something, like I can go to a professor that I've had previously and say like, hey, I need like advice, and they can be like, okay, that's like fine. They're super willing to just meet with you one-on-one about anything, and I really like that.
The great thing about the pre-health program here at Shenandoah is it's open to any student who has the desire to study a healthcare profession in the future. We all come into a healthcare profession at different phases in our lives. So the pre-health program here is designed to accommodate students who want to pursue a health profession at any point. Although there are many different health professions, the qualities and characteristics that a student needs to develop while they're in their undergraduate education are the same. Here within our pre-health program, we cohort our students, which means that we put them together in sections of foundational science classes together. So they are learning things like biology and anatomy and physiology and psychology together with their peers who are also pursuing a career in healthcare.
I have been through physical therapy many times, so that made me want to become a physical therapist.
My goal is to become a pharmacist.
My goal is to be a physical therapist.
I'm having a lot of fun learning while getting to meet a lot of new people.